So for us, we had quite a few programs that we had to transition to be able to serve the community. Our biggest need has been around food right now. So traditionally we were providing case management services, which included a food pantry. Our food pantry had to transition to a drive-through food pantry. And in the first 2 months, we had a huge influx of people coming to us for need. April 2019, we served 95 households, and in April of 2020, we served 371 households. So when we think about the increase in the number of households that we're serving, we're actually serving 3 times more monthly than we've ever served historically. We actually did a survey. We're pushing out surveys across all of our programs. And that actually made me think when you were saying earlier, some content that you can use. I think our survey results will be really helpful for United Way to have some content to use, and trying to make some infographics and different things that would be helpful on our end for you. So from our food pantry survey, we had 113 of the 371 households that chose to participate. We incentivized the survey by offering a $25 giant gift card. So if they filled out the survey, they were entered to win a gift card for the grocery store. 2 interesting things that came out of the survey. There was a lot of information, and I'm happy to share the full results, but 1/3 of the households expressed that even with our help, they're still skipping meals. And so that was really powerful to me, and that even though we're here and we're helping, to me, collaboration is so important because no one agency can meet all the needs. And also, I think understanding what the needs truly are and the depth of the needs right now. So another piece of that is that of those households, there's 41 children in those households. So I think about, so those households are skipping meals. There's 41 children in those households that are skipping meals. And that just worries me. And that's the reason that we're here and that we're serving the people the way that we are through this. 2/3 of those households expressed anticipating having housing or utility related needs moving forward. So that's sort of what we're preparing for as being our next chapter with our case management program right now. So we have had an increased need for the food pantry, but we know that it's going to shift. While the food pantry need probably might not decline, we're going to also then have the utility and housing related issues. And I did make a note here for Berks Coalition and homelessness. Any collaboration that we can do would be great, because we're just not, we're here and we've always been serving housing needs, but not this level. So I just want to make sure that we're doing a good job of meeting the influx that's ahead. So we are still providing case management over the phone, but I loved your idea of the window. So I think we'll try to look at something where we can have people come into the building in that way. We've never stopped operating here. So all of our staff has still been coming in. We keep our doors locked. We're all following the protocol with the mask and the cleanliness and all of the things that were best practices to be able to keep our doors open in terms of employees in the building. So the senior center, the food pantry distributed 54,000 pounds of food in the first 8 weeks. A typical 4-month period, we would distribute 10 to 14,000 pounds of food. So a really big difference for us in terms of distribution. They took a lot of adjustments for our pantry staff to be able to meet the need, and they did a great job. So our senior center services. So every day we have a senior center. Every day at lunchtime we served a meal. Our dining room had a capacity of 161 people. So that was really the cap of how many people we could serve on any given day. So it's been really interesting because we're now serving the meal in the parking lot where there's no capacity. And we went from serving 1,971 meals in January to 3,347 meals in April in the drive-thru to seniors. So a 70% increase. And the seniors have expressed to them that the food is very important, but also the fact that they have a reason to get up every day. They brush their teeth, they put their clothes on. And they see staff, they see familiar faces, even though we're behind masks. But just knowing that there's that mental health side of it, that it's giving them a reason to get up and get out and move their bodies and get outdoors. So I think there's so much more to it than just the meal. Our bus drivers, we traditionally have a bus that would pick up seniors and bring them to the center. We don't have a need for that right now. So our bus drivers have been delivering meals to seniors in their homes. I'll just go quickly through the rest of it. So Meals on Wheels has continued. We experienced a 15% increase in the number of qualified recipients, but we also experienced a 29% volunteer cancellation rate due to people not being comfortable visiting homes. But we were very fortunate in that we had a list of volunteers interested in volunteering because they either lost their jobs or they were working from home and they had more flexibility. So new volunteers stepped right up, which was amazing. We did do 10 shelf-stable meals for each Meals on Wheels recipient in case there was some reason that we had to close our doors and we weren't able to operate for a week. So over 7,000 meals were delivered in the first 8 weeks since everything happened. For us, doing surveys across all of our programs is really important right now. Worries and concerns for us moving forward would be meeting the needs of those we serve at an unprecedented level and just making sure that we understand what the gaps are and that we're able to respond. Number 2 for me is employee burnout, because it's been really hard on our employees being in the building, working nonstop at a level. I mean, we prepare all of our meals on site. So to know we went from preparing, 1,700 meals in our kitchen to over 3,000. It's been so much more work on our staff, and they've been doing a great job, but I just worry about the mental health for them too. And then number 3 is finances for July through December and beyond, because we had a lot of community support in these past few weeks since everything happened. That reminded me of the influx of donations we would receive around Christmas time from like November to December. And then in January and February, we always had a lull of less support. And I guess in my mind, my fear comes from we're having great support right now. And then, 6 months, 12 months, it worries me of, everyone being in different financial situations and we might not have as much support. So I think for us, it's just trying to be proactive in addressing all of that. And one thing I heard, I don't remember if it was through United Way or a different channel, at the beginning of this, the recommendation was to be calm, collaborative, flexible, and determined. And I think those are things that our staff have been doing through all of this, but we certainly couldn't do it without the partnerships in the community, such as United Way. So thank you. And I really love the opportunity to learn from other organizations and what they're doing. So this has been very helpful for us today.